let's take a moment and talk about back pain. Back pain is something that is an absolute epidemic in today's world. In fact, it's right up there with the cold and flu for reasons that people miss work. If we take a look at our spine model here, there's 24 vertebrae in the spine, 7 in the neck, 12 through the mid-back, and 5 in the low back. And then, of course, we have our hips. And, of course, the skull sits right on top here. Now, in the neck, we have spinal nerves which exit. They go to your shoulders, your elbow, your wrist, into your hands, in and around the throat, up into the head. We look through the middle back where all the ribs are. These nerves are exiting and going to your vital organs and the muscle tissue surrounding the middle back. And then we get down to the lower back. And of course, all of these nerves go across the hips, down into the leg, all the way to the feet to power the leg. And anytime any one of these vertebrae in the spine, or several, many times there's several of these vertebrae that have misaligned from what? Sitting at the desk all day long. I know you may be commuting to Denver. Maybe you're on a long commute to a vacation. Maybe it's riding in airplanes all the time. Maybe it's playing with your kids, lifting up your kids, even delivering a baby through this outlet can and will shift the vertebra for mom. And if they're even pulling on the child, can twist and shift these vertebrae in the baby. So if we look at this a little bit more closely, of course, anytime we have a vertebra that shifts out of alignment, no pill, no hot pack, no cold pack, no surgery can correct that. So what do we have to do here? Boom! We got to shift that vertebra forward, get that pressure off of the nerve so the nerve signals can continue to flow to the tissue that it's going to, depending on the level of the spine, and do that with some repetition to retrain the spine and start to get you better naturally, conservatively, and without pills, potions, or lotions. Of course, I myself have an old low back fracture and low back injury that if I were not under regular chiropractic care, it would have rotted out and worn down a long, long time ago, but I've been able to conservatively manage my low back issues. So now I've dedicated the rest of my life to do the same for you. We look forward to meeting you. Thank you for checking out the video, and we're here to help any way that we can.